Thank you, Inspector General Levinson. And thanks again to each of you for getting up this morning and coming out to hear our compliance message. For those of you on our webcast, I'm about to dive into the overview of the healthcare fraud and abuse laws. So if you haven't had that cup of coffee yet, now's the time to go get it, because it's early in the morning to be talking about Stark. But as you know, our focus today is healthcare compliance. But what does that really mean, and why should healthcare compliance matter to each one of us here in this room? We're talking about complying with the healthcare fraud and abuse laws. The consequences for violating these laws can be severe. So it's important to have an effective compliance program in place now so that you can catch your problems early. During this first session, I'm going to provide an overview of the fraud and abuse laws that you need to be aware of and give you some examples of some problematic practices that we've seen at OIG in our compliance oversight. Then Amanda Walker is going to talk to you about some compliance program basics. Tony Maida will give you some more advanced tips on operating and implementing an effective compliance program, and Geetha Kavetti will talk about understanding our program exclusions authority and how to utilize our exclusions database. Before we begin, I want to point out our handouts that you either printed out online or picked up this morning. The first 5 or so correspond to my presentation. I've got a list of the statutes I'm going to go over this morning, so you don't need to be feverishly jotting down notes because all the statutes are cited in your handouts. I've got a list of the physician self-referral law exceptions and some of the commonly used safe harbors. There's a handy chart in the handouts that compares the kickback statute to the physician self-referral law, and a Stark analytical framework and some compliance tips that we came up with. So those first few documents will correspond to my presentation. Before I begin, I want to point out another free educational resource that you should look up after this program if you haven't already seen it already. It's the OIG's Roadmap for new physicians. This brochure is for new physicians, but it really contains an excellent summary in layman's terms of the fraud and abuse statutes that I'm going to go over this morning. So if you haven't seen it, it's just a great resource for free. You can go online, download a color brochure. You can also watch a PowerPoint presentation with an audio narrative and use it as an educational tool for yourself and as well as for your office staff. So let's get started. I'm going to go over the 5 main federal fraud and abuse laws that you need to be aware of as a healthcare provider. We're going to talk about the Physician Self-Referral Law, or Stark, the AntiKickback Statute, the False Claims Act, the Civil Monetary Penalties Law, and our exclusion authorities. I'm going to walk you through each of these statutes and give you some examples and sort of try to bring these statutes to life for you this morning. I'm going to start out with the Physician Self-Referral Law and the Kickback Statute. A lot of people confuse these two statutes. They seem sort of similar in a lot of people's minds, and a lot of people, when they're asking me to analyze an arrangement for fraud and abuse consequences, they can't always see the distinction between the two laws. So I'm hoping to point out some of the distinctions between the Stark Law and the Kickback Statute, as well as some of the similarities for you today. The reason that the two laws sound sort of similar to a lot of people are because the underlying rationale for these two laws is similar. Both statutes were created to prevent improper referral relationships. Improper referral relationships are illegal because improper referrals can lead to harm to our federal healthcare program beneficiaries, and they can also harm our federal healthcare programs. Specifically, improper referrals can lead to overutilization of items and services, increased program costs, corruption of medical decision-making, the steering of patients based on a referrer's self-interest rather than a patient's best medical interest, and unfair competition. The government wants healthcare providers to make referrals for items and services based on a patient's medical need and not for providers' own personal financial gain. The Stark Law and the Kickback Statute are 2 different statutes, but you have to comply with both. When I'm analyzing an arrangement under the fraud and abuse laws, I always start out with the Stark Law. So I'm going to start out with Stark this morning. So the Physician Self-Referral Law prohibits a physician from referring Medicare patients for designated health services to an entity with which the physician or his or her immediate family member has a prohibited financial relationship. If a physician makes such a referral, the law prohibits that entity that furnished the service from submitting a claim for that service to Medicare. Well, that's sort of a mouthful, so let me kind of bring that, unpack that a little bit for you this morning. I think the simplest way to start your Stark Law analysis is with these 3 simple questions on my slide. This is what I do, and so I thought that I'll just sort of put it out there to the public as to how, sort of creating an analytical framework for each of you as a starting point with your Stark analysis. First of all, is there a referral from a physician for a designated health service? The terms have specific meanings in the law, and generally speaking, a referral is a request by a physician for an item or service payable by Medicare or Medicaid. Chances are, if you're a healthcare provider and you're participating in the federal healthcare programs, you're going to have a referral. Then go on to look to see if you have a physician. You'd be surprised how many people ask me to analyze an arrangement, and when I actually look at the facts, there's not a physician anywhere in the arrangement. If you don't have a physician or a physician's immediate family member in your arrangement, you don't have a Stark issue. So that's just kind of an important threshold issue to look for. Then finally, the arrangement must involve one of the 11 designated health services. I put a list of these designated health services in your handout, but what I'm talking about when I say DHS are inpatient, outpatient services, imaging services, DME, physical therapy, home health, just to name a few. If you have a referral, you have a physician, and you have a designated health service, then the Stark Law is implicated, and you move on to question 2. If you don't have a referral, a physician, or a designated health service, then the Stark Law is not implicated, but you still need to move on to analyze your arrangement under the Kickback Statute. Okay, so that's a general idea of what the Stark Law is meant to prohibit. Let's talk about what happens when you violate the law. Excuse me, I think I skipped over the 3rd one. Sorry about that. This is actually the most important one. Once you've determined that the Stark Law is implicated, then you have to find an exception. So look to see if your financial relationship meets an exception. Let me go over I actually might have skipped over the, let me back up again, I'm sorry. What we need to do is, first of all, we also need to talk about the financial relationship element as well. Financial relationships include ownership and investment interests as well as compensation arrangements. So anytime a referring physician has a financial relationship like an office lease or a medical directorship with an entity that furnishes designated health services like a hospital or an imaging center or a lab, the Stark Law is implicated and should be analyzed. I would also point out that a financial relationship can also arise from the receipt of gifts or trips or sporting event tickets. So if you've answered yes to question 1, you've answered yes to question 2, then you move on to question 3. Does the financial relationship fit into a Stark exception? You must squarely fit into a Stark Law exception when the law is implicated. There are many exceptions to the Stark Law that you can use to structure your financial relationships. Some of the exceptions are for example, employment arrangements or office or space lease arrangements or personal services arrangements. I've put a list of your exceptions in one of your handouts. Okay, so now we're ready to change slides. The penalties for the Stark Law violations can be very significant. An entity that submits a claim to Medicare in violation of the Stark Law owes back the entire amount of the claim, even if the patient got the services and even if the services were medically necessary. Parties that knowingly submit claims in violation of the Stark Law or cause such claims to be filed can also be subject to False Claims Act liability, civil monetary penalties, and program exclusion. But everyone here in this room is trying to do the right thing, so what you really need from me this morning are some Stark Law compliance tips. So I've come up with a short list of a few things you can do to keep yourself in compliance with the law. Number 1, meet a Stark Law exception. As I said before, make sure you're your arrangement meets every prong of an applicable exception. And don't forget to analyze your arrangement under the Anti-Kickback Statute. Number 2, make sure that you properly document all of your financial relationships with referring physicians and have a contract management system in place to track them. What I mean by that is arrangements with referring physicians need to be in writing and signed by the parties. The documentation needs to reflect the actual services that are rendered by the parties. If you enter into an agreement for personal services with a referring physician, can you show that the work was actually done? Did you maintain accurate time logs? Did you maintain time records? That's the kind of documentation that I'm talking about under number 2. Number 3, have systems in place to ensure that your payments have been properly structured. This is a really important one. Different exceptions under Stark have different payment requirements. For example, some of the exceptions require payments to be fair market value, not taking into account the volume or value of referrals. Some of the exceptions impose an additional requirement that the payments be for a legitimate business purpose. It's important that you have a system in place within your organization to ensure that your business people are talking to your compliance people. So when your business people are out in the field negotiating some of these arrangements with your referring docs, that they're actually communicating that information back to your compliance department so that the deal that they're out there negotiating actually complies with a relevant Stark Law exception. And it's important to have this system set up before these arrangements are entered into, rather than after they've already occurred. Also, one other important thing to keep in mind is that you need to employ a reasonable method to determine that payments are fair market value and don't take into account the volume or value of referrals. A common fair market value problem that we see at OIG involves DHS entities that hire medical directors for their facilities. Here's a compliance tip for you that's pretty easy. Hiring more medical directors than you could ever possibly use has no legitimate business purpose, and it may also suggest that the payments are not fair market value for actual services rendered. Okay, number 4, watch out for lease creep problems. What I mean by this is sometimes a DHS entity like a hospital will enter into a space lease arrangement with a physician practice that refers to the hospital. And sometimes the physician may be actually occupying or utilizing much more space than is contemplated in the lease document. So that's what I mean by lease creep. The result of that type of arrangement is that the rental value paid by the practice may end up being below fair market value. So my compliance tip to you with respect to leases is put a system in place to notify you when your leases are about to expire. Make sure you're collecting rent properly and that the rent is fair market value for the space that's actually leased. Number 5, review productivity bonuses. Pay special attention if you're paying productivity bonuses to your physicians. If your productivity bonuses include payments for ancillary services that are not personally performed by the physicians, you could have a problem. There are some special rules for these types of compensation arrangements under Stark, but basically productivity bonuses need to be carefully reviewed for compliance with the Stark Law, and this may be an area where it might be smart to reach out to your healthcare regulatory counsel. Number 6, remember that gifts can implicate Stark too. As I said before, we often see DHS entities offering gifts like expensive concert tickets or sporting events tickets, or sometimes we see the referring physician soliciting these types of gifts from the DHS entity. These types of relationships also can implicate Stark. We also see instances where in-kind services like free scheduling services or free office administrative services are being offered to referring physicians, and you need to keep in mind that those types of gifts can implicate Stark as well. So that's a very, very brief overview of the Stark Law. Let's move on to the Anti-Kickback Statute. So what does the Kickback Statute prohibit? The Kickback Statute says that you can't offer, pay, solicit, or receive anything of value to induce or reward referrals of federal healthcare program business. In some industries, it's acceptable to reward those who refer you business. In healthcare, it's a crime. It's a crime to reward referrals of federal healthcare program business. and the prohibition applies to those who pay kickbacks as well as those who receive them. So what happens if someone violates the kickback statute? Well, unlike Stark, the kickback statute is actually a criminal law. Violating the kickback statute is a felony, and conviction can result in fines up to $25,000 per violation, up to a 5-year prison term, or both. Kickback violations can also lead to False Claims Act liability, and OIG also has authority to exclude violators from participating in our federal health care programs. OIG can also subject a party to a $50,000 civil monetary penalty per violation and an assessment of up to 3 times the total amount of the kickback, even if some part of that payment was for a legitimate purpose. So I know everyone here wants to comply with the law. Let's talk a little bit about what that statute really means to see if I can bring it to life with a real-life example. I picked this case because I think it's a really good example of an instance where the government prosecuted not only the device manufacturer that paid the kickback as well as the physician who received it. So in this case, we settled with some device manufacturers for allegedly rewarding physicians with lavish vacations, gifts, and annual consulting fees as high as $200,000 in return for the physician's endorsement of their hip and knee implants and the use of these implants during their surgeries. I think it's really important to note that one of the orthopedic surgeons involved in this scheme paid $650,000 to resolve allegations that he accepted payments from these device manufacturers in exchange for using these products in his surgeries. It's also notable that the device manufacturer paid $311 million to resolve allegations in this case. So that's just an example of what can happen when you violate the law. But we're all trying to do the right thing, so let's get to some compliance tips. Here are 3 things that you can do to help your organization comply with the kickback statute. Number 1, always use a safe harbor. There are a number of safe harbors to the anti-kickback statute. Whenever possible, try to use one when structuring your business relationships. I've listed a number of the commonly used safe harbors in your handouts. And I would also note that in order to meet a safe harbor, you must squarely fit with and follow each prong of that safe harbor in order to have the protection of that safe harbor. It is also important to note that because the kickback statute is a criminal law that is an intent-based statute, compliance with a safe harbor is voluntary, but it's the safest thing to do when you're looking to comply with the kickback statute. Number 2, it's a one-purpose test. The anti-kickback statute is violated if one purpose of your business arrangement is to induce or reward referrals. So the best way to avoid that is to avoid relationships that have this purpose. And number 3, this is probably the most important rule of thumb: fair market value for actual and necessary services. Much like the rule in Stark, it's always good to ensure that any remuneration flowing between the parties of an arrangement is fair market value for actual and necessary items furnished or services rendered, and the payments don't take into account the volume or value of referrals. Sham arrangements, freebies, arrangements that are above or below fair market value, all of these types of things may just be vehicles to disguise payments for referrals, and you should watch out for those. So that's a very brief overview of the Stark and kickback statutes. The penalties for both of these laws can be very substantial, so it's important to keep these compliance tips in mind and monitor all of your financial relationships with your referring physicians. So let's move on to the False Claims Act. The False Claims Act provides a way for the government to recover money when someone submits a false or fraudulent claim to the government, including the Medicare and Medicaid programs. Claims may be false if the service is not actually rendered to the patient, is provided but is already covered under another claim, is miscoded, or is not supported by the medical record. So this is my favorite slide in the whole presentation. If you take away one thing from my speech today, let it be this slide. because I'm not talking about innocent billing mistakes here. I'm talking about claims that the provider knew or should have known were false. The legal term for should have known is deliberate ignorance or reckless disregard. This means you can't hide your head in the sand and avoid liability. Healthcare providers need to know the program laws and rules that you're navigating within, and you need to make sure that you're in compliance, and you need to take proactive steps to do things like implementing internal audit programs so that you can monitor the fact that you're in compliance with the law. I would point out that even if you make an innocent billing mistake, you must repay the government. The Affordable Care Act included a new requirement that providers must repay overpayments to Medicare and Medicaid within 60 days or be subject to penalties. In addition to serving as a great enforcement tool for the government, the False Claims Act also provides a strong financial incentive for whistleblowers to come forward with fraud allegations. Whistleblowers can receive up to 30% of a False Claims Act recovery. Often, whistleblowers turn out to be ex-business partners, hospital or office staff, competitors, even your own patients, maybe even your ex-wife. It's not the government that should keep you up at night, it's your own employees. So the penalties for violating the False Claims Act are also very substantial. A provider can be penalized up to 3 times the program's loss, plus $11,000 per claim. And penalties add up quickly because each claim that you submit is a separate ground for liability. So many of you are probably thinking, well, I've heard of the False Claims Act, I've seen it in the newspapers, I've seen some of these big billion-dollar settlements that the government's entered into with these pharmaceutical manufacturers, but that doesn't really apply to me because I'm just a small provider. I'm not a big pharmaceutical manufacturer, so I'm not sure that statute really applies to me. Well, there are many cases that actually involve small entities too. One example of this involved a False Claims Act violation with a cardiologist, and in this case, the cardiologist paid $435,000 to settle False Claims Act liability, and he also entered into a 5-year corporate integrity agreement with OIG. In this case, the cardiologist was allegedly submitting claims for consultation services that weren't supported by the patient medical records and didn't meet the criteria for a consultation. The physician also allegedly submitted false claims for separately billing evaluation and management code services that were paid for as part of nuclear stress test claims. So the False Claims Act can apply to big entities and small entities. But as we all know, we're all here to try to do the right thing, so what you really need from me this morning is some compliance tips on how to comply with the False Claims Act. The best thing that you can do to avoid False Claims Act liability is to implement a robust internal audit program within your organization. There are lots of ways to design an internal audit program, and OIG doesn't really dictate the parameters of that program, but at sort of a threshold level, what I like to tell people to do when you're contemplating structuring your own internal audit program, to think, how does my business bill the federal health care programs? What lines of service am I in? What are the primary services that I provide, that I bill to the Medicare and Medicaid programs? And then develop a system to audit those claims on a regular basis. So that's a very quick overview of the False Claims Act. Let's move on to the Civil Monetary Penalties Law. The Civil Monetary Penalties Law, or the CMP, provides a different way for the government to pursue fraud. The OIG has authority to impose CMPs for a variety of reasons, such as presenting a false claim. We have penalties for other conduct too, such as employing an excluded individual or making false statements on a provider enrollment application. The penalties under the CMP can range from $10,000 to $50,000 per violation and up to 3 times the amount claimed. One of the things that we often see providers get into trouble with, and we often impose civil monetary penalties on, relates to employing an excluded individual. Geetha Kavedi is going to talk a lot more about this in a few minutes, but just as an example to kind of bring the CMP to life for you this morning, We settled a case with a nursing home for over $100,000 in CMPs for employing an excluded licensed practical nurse. Here, the nurse was excluded at some point during his or her employment. Maybe the nursing home checked to see if the person was on the exclusions list when they submitted their employment application, but they failed to check to see whether the person became excluded during the term of their employment at the facility. This mistake resulted in significant liability for the nursing facility. So the lesson that you should take away from that case is that it's very important as a healthcare organization that you know who you're doing business with. And then finally, you need to be aware of OIG's exclusion authorities. OIG has mandatory and permissive exclusion authorities. I'm not really going to get into this in any detail because Geetha is going to talk about it at length. But the bottom line with respect to our exclusion authorities is that you need to know that there are a number of reasons why a person could be excluded from participating in federal health care programs. If someone has been convicted of certain crimes, it makes sense that the federal government doesn't want that person billing our federal health care programs. And so that's the purpose behind OIG's exclusion authorities. So that concludes my discussion of a very broad overview of the fraud and abuse laws that you need to comply with. I'm going to turn things over to Amanda Walker to give you some compliance program basics.